Picture a young woman standing in line at a coffee shop. From the outside, she looks perfectly calm, waiting her turn to order. But inside, her cardiovascular system is running a marathon. Her heart is hammering at 130 beats per minute, the same pace as sprinting on a treadmill. She is experiencing a condition called postural orthostatic tachycardia syndrome, or POTS. It causes an extreme physiological reaction to a very ordinary force, gravity. Because she looks completely healthy on the outside, but is enduring intense physical stress on the inside, she lives in a massive empathy gap. It is incredibly difficult for others to see the exhaustion she feels just by standing still. A clear pattern emerges. 80 to 90% of POTS patients are women, typically between 15 and 45. The onset is almost always tied to a physical stressor. The body undergoes a major biological event, like a severe viral infection, surgery, or pregnancy. Following that stressor, the autonomic nervous system starts to glitch. This is the body's background autopilot, the system that handles automatic processes like breathing, digestion, and blood flow without you ever having to think about it. This means the onset of POTS is the direct result of a physical system struggling to recalibrate after surviving a severe biological stress. It is a mechanical malfunction, entirely separate from mental illness. To understand this mechanical failure, let's look at a healthy circulatory system. When you stand up, gravity naturally pulls your blood down. To counter this, the blood vessels in your legs automatically squeeze, acting like a pump to push that blood back up to your brain. In a body with POTS, that lower body squeeze never happens. The blood vessels stay relaxed, allowing a large amount of blood to drain downward and pool in the legs and abdomen. The brain quickly realizes it is losing its blood supply and sounds an alarm. In a desperate attempt to force that heavy, pooled blood back to the top of the body, the heart begins to beat at a rapid, exhausting pace. This chart illustrates the systemic fallout of that poor circulation. Because the brain is constantly fighting for oxygen, patients experience severe cognitive impairment, commonly called brain fog, alongside extreme, unexplainable fatigue. The lack of upward flow also causes one of the few visible signs of the condition, acrocyanosis, where the skin of the hands and feet takes on a purplish color, as blood visibly pooling in the limbs. The body is constantly fighting a losing battle against gravity, draining the energy needed to simply attend a class or sit at a desk. Because of this systemic circulatory failure, many patients lose their ability to maintain baseline daily functions. Because a racing heart and shortness of breath look identical to panic on the surface, patients are frequently misdiagnosed with anxiety. But the clinical standard for identifying POTS relies on hard, objective data. This diagram outlines the active stand test, measuring heart rate and blood pressure changes while the patient moves from lying down to standing, monitored continuously over a 10-minute period. This graphic shows the exact mathematical threshold for a diagnosis. During that standing test, the patient's heart rate must jump by at least 30 beats per minute, or 40 beats if they are between the ages of 12 and 19. Crucially, their blood pressure must remain relatively stable. If their blood pressure plummets, the diagnosis shifts to a different condition entirely, known as orthostatic hypotension. Meeting these strict numbers removes the guesswork. It definitively proves the racing heart is a physical reaction recorded by the monitor, invalidating dismissive psychological misdiagnoses. Once diagnosed, patients use an arsenal of strategies to artificially manage gravity. This illustration highlights the first step: aggressive volume expansion. By consuming 2 to 3 liters of water and 10 grams of salt a day, patients can physically fill their blood vessels and increase their total blood volume. Next is strategic compression wear. Firm, waist-high garments physically squeeze the lower body from the outside, preventing blood from pooling in the legs and forcing it upwards. Patients also use recumbent exercises, activities like rowing or swimming where they remain seated or flat. This allows them to safely rebuild their cardiovascular strength without forcing their body to fight gravity. When lifestyle adjustments aren't enough, doctors turn to specific medications. Looking at this pharmacological flowchart, we start with volume expanders like flutrecortisone. These medications command the kidneys to retain salt and water, further boosting the amount of fluid in the system. Next are vasoconstrictors like midodrine. These act as the chemical equivalent of compression pants, sending a signal to the blood vessels to physically tighten and push blood upward. Finally, medications like ivabradine or propranolol are used for heart rate reduction, directly commanding the heart's pacing node to calm down. Managing POTS rarely relies on a single magic pill. It requires meticulously layering these multiple lifestyle tools and medical therapies to build a customized, sturdy support system for the body. Which brings us back to the coffee shop. Beneath the surface, this woman is relying on high sodium intake, firm compression gear, and carefully prescribed medications just to stand comfortably in this line. Standing up may always require extra effort for her, but the physiological reality of POTS is highly measurable, entirely valid, and with the right combination of support, effectively manageable.